Hi, welcome back, friends. I'm Dr. Sneha Sunarkar, and today we are going to discuss on extraction, like what all things we are going to follow after extractions, and mainly these are the do's and don'ts of extraction. Mainly, what is extraction? Generally, what happens whenever there is caries and when your dentist or the restorative dentist is not able to conserve that tooth, he will advise that particular tooth for extraction. The second thing might be because of the orthodontic purpose, like whenever you have to place up braces and you don't have any kind of space, then for that particular condition the dentist will advise you for extraction. So this is the second case. Third, if the tooth is periodontally compromised, if the surrounding tooth structure is not that good and the tooth is mobile, then in that particular scenario again your dentist might advise you for extraction. So when you go for extraction, there are few things which you should follow, and this will help you for a good kind of healing after extraction. Okay, so I will discuss few do's and few don'ts which you are supposed to follow after extraction. So what is the first do? So many of you might have already undergone extraction, and you might have experienced that your dentist will place some kind of gauze pack on the extraction socket. Okay, so that particular gauze pack should not be removed for at least 30 to 45 minutes after extraction. This is the first do. So after 30 to 45 minutes, you have to remove that gauze pack. Your dentist will also advise you to remove that gauze pack. So this is the second do. The third do is that after like extraction, because there is trauma to that periodontal tooth structure, and to reduce the chance of swelling, your dentist again will advise you to apply ice externally. Again, I am telling you the word externally. So uh, you have to either take the ice on the gauze in the glove, or else just wrap it around with the cloth, or else if you have an ice pack, then that is well and good. So you have to just keep applying ice externally. So you have to apply mainly 3 to 4 times a day. This might again solve your problem. So this is the third do which you have to follow. Okay, the next fourth do is that you have to consume medicine, whatever your dentist might have prescribed. Mainly the medicine which generally dentists prescribe is the analgesic. So because the effect of anesthesia generally wears off at around 2 to 3 hours, or else sometimes it wears off very early. So in that particular scenario, patient should not experience any kind of pain, so we prescribe analgesics for that particular day. So you should consume that, and this will take care of your pain. So this is the fourth do. The fifth do is that always consume semi-solid food and not in any kind of hard food, because this will cause trauma to that extraction site. The sixth do is that always consume food at a room temperature during winters, and in a cold form in other seasons. So this will again help you to like this will not exaggerate the kind of swelling or else pain which you have. This will help to contract the tissue and help the better healing. Now the next, many of my patients ask me that can we brush our teeth? Yes, you have to brush your teeth after extraction. It is not like that you have done your extraction and not brushing your teeth. So you have to brush your teeth. You have to generously brush your teeth each and every day, even after extraction. Just you have to take care that you don't spit vigorously after extraction for 2 to 3 days after extraction. And the second thing is that your brush should not cause trauma to the extraction site. So these are the 7 do's. The last do is that you have to visit your dentist if at all required. Sometimes what happens, in some cases there is pain, or is extreme pain, or is swelling, or else in some cases, in a worse scenario, what happens that the bleeding does not stop because of some of the issues which I have already mentioned in the do's. If you have not followed this particular do's, then there might be chance of severe bleeding. So if at all this happens, okay, you have to visit your dentist ASAP. You can call your dentist and take his appointment, and you can visit ASAP. This will take care, and this will reduce any other kind of complications. These are few things which you have to follow. So visit your dentist after extraction as well, just to check whether there is any kind of complication, or how the kind of healing is. Okay, so these are the few do's. Now I will be discussing about don'ts which you have to follow after extraction. The first and foremost don't is that, as in the first do, is that you don't have to keep that cotton gauze pack inside the mouth for at least about 30 to 45 minutes. So when you are placing that, you don't have to spit. Okay, this will again cause intraoral pressure. Okay, so don't spit. Whatever there is inside your mouth, just swallow it. Nothing is going to happen. Okay, this will be taken care for your good healing. The second do is that avoid spitting for at least 24 to 48 hours. Okay, this will help to stabilize the blood clot on the extraction site and accelerate the healing process. The third do is that you don't have to consume any kind of hot food. Okay, so don't consume any kind of hot and hard kind of food structure. Okay, just you have to consume semi solid food. Okay, and this will take care of your good healing. And avoid application of any kind of, this is the fourth don't. Okay, fourth don't, sorry, I said, I think the third one I said do, it's don't. And the fourth don't is that you don't have to apply any kind of wicks or else balm or hot fomentation externally. This will exaggerate your swelling or else pain, whatever is there. Just apply ice externally. Now the last thing which you have to follow after extraction is that don't consume anything with the straw. Okay, don't consume anything with the straw. What will happen if you just if you have anything with the straw, like juice, cold coffee, or whatever is there, so it will just, you have to close your lip and you will create an intraoral pressure to just suck that. So it is again not good. This will again dislodge the clot. So don't have anything which will create an intraoral pressure. This will again have create complications after extraction. So these are few do's and don'ts. I will just write it down, and just in the next few seconds you will get one slide. Okay, you can take that, and just you have to follow this do's and don'ts. These are the few of them. Okay, there are many other things as well. So these are few basic things which you have to follow. This will again accelerate your healing. Okay, have a good day, take care, and if you want any kind of advices or else any kind of instructions, if you want me to add on, you can just drop down a message. It will be taken care of. Yeah, take care, have a good day, bye.